How can you understand a health insurance plan? It's a really simple question that a lot of times we don't do a very good job of answering. You look at a health insurance plan and there's sometimes just look like another language, and that's because it kind of is. My name's Alex. I help people with health insurance all the time. I want to take just a minute to help you understand what you're looking at when you look at a health insurance plan. Okay? The main thing you need to know are three terms. These three terms you're going to see on almost every health insurance quote you look at. If you understand what they mean and how they function, you'll understand what you're buying or considering buying. Okay? Let's look at the three terms. Deductible. I'm moving from the bottom up. Deductible, co-insurance, nobody knows what that means, and out-of-pocket maximum. Okay, I want to show you how they work. First of all, the deductible is what you pay for healthcare before the insurance company really starts paying for stuff. Okay, we're excluding copays from this. So let's say you have a plan with a $5,000 or $6,000 deductible. That's pretty common. Okay, so let's say you've gone to the hospital with a major medical event. All right, the first $5,000 in our example, you're going to pay that because that is your deductible. Okay. Now, what happens after that is called coinsurance, and this is where it gets really confusing. Sometimes you'll see 80-20, maybe it's 50-50, maybe it's 70-30. That's the coinsurance percentage. Let's just say 70-30. Okay, 70% and 30%. After you've paid the first $5,000, in this next section of your bill, it's going to be divided. The insurance company in our example is going to pay 70% of the bill, and you're going to pay 30% of the bill. You think about your coworker, somebody you work with. So now when we're co-insuring, we're paying together. The insurance company is paying 70%, you're paying 30%. Now, any health insurance plan that's really worth having is going to have an out-of-pocket maximum, okay? That is your absolute limit on how much you're going to pay. That's the whole point of insurance, is we're putting a cap on what you're going to have to pay for this medical event, what you're going to pay for medicine for the year, okay? Let's just say in our example, we've got a $5,000 deductible. Okay, so you pay $5,000. Now we have 70-30 co-insurance with an out-of-pocket maximum of $10,000. All right? So here's what's happening. The first $5,000 in the year are paid by you. Yay. The next, in this case, $5,000 is divided. They're paying 70%, you're paying 30%. When you have paid $10,000, you're done. At that point, your health insurance plan should cover 100% of covered costs. Now, everything you paid up to here stops. Even if you have copays, those go away. All of it contributes to that $10,000. And that's why when you look at a health insurance plan, the most important number is not the deductible. It's not the coinsurance. It's the out-of-pocket maximum, because that's your worst case scenario. If you understand those three things, it'll help you go a long way to understanding what your options are. I help people with it all the time. I'd love to help you. If you need help, find me in the link in the bio, reply to this video. Let's get in touch and talk about it.